signs, and they took a radiograph and found a huge adult canine tooth up in the nasal cavity. So it's a 2.5-year-old Jack Russell Terrier, and so we're about to do a little dorsal rhinotomy to go in there and find that tooth. So the first thing that we're going to do is inject some lignocaine and mepivocaine in the infraorbital nerve to provide some pain relief. It's a little bit reactive under the anesthetic, so we're going to try to help out a little bit. So Ewan is sticking the needle into the infraorbital foramen, aspirating a little bit, make sure we're not in an artery, and then injecting some mepivocaine and lignocaine into the nerve. So that's the first step. And then the next step is going to be to make a skin incision. Yeah, great. Yep. And this is going to bleed an annoying amount because it's the face. And so I can palpate the rostral end of the dorsal nasal bone. Making a little incision here. And I do a lot of my incision with electric cautery like I normally do, but in particular in this case because facial wounds do tend to bleed a lot. Camille, I'm sorry, I forgot my loops. Can I please have them? They're out there, close to Tommy. So we're going through the platysma muscle, and then there's some other muscles of facial expression. That we are going to incise.
Well, do you want the small tip ones?
Are those smaller? Yeah, thank you. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. Thanks for that. Thank you. All right, so I use loops for pretty much everything because I'm old and farsighted. I'm just palpating down onto the bone here, probably cutting through some branches of the infraorbital nerve, which comes out of the infraorbital foramen. Right, Ashley?
Yep.
Might extend my incision a little bit farther cranially. I'm getting into the cartilage of the area rostral to the dorsal nasal bone. I'll just scrape some bone, periosteum off the bone here. I can feel that we're kind of down to where the gum attaches to the maxilla, and I was debating whether I was going to go intraoral or extraoral with our exploration, but I decided to go extraoral because I was concerned about it being kind of a bit of a bloody mess, trying to go the other way. So we'll just get our Gelpies in a little bit farther. Okay, so that's the rostral end of the dorsal nasal bone right here, and that tooth is just going to be right inside there. We could almost get away with Carisons rather than a burr, but we've got the expensive burr out, so we'll go ahead and use it. We have a neuro kit here. Do we have a kerosene in the neuro kit? Keep suctioning as I burr. The bone is surprisingly thick there. We're in the nasal cavity, and so we are going to get some bleeding just from the turbinates. Now, I expected us to be just looking right at it. Camille, can you bring up the CT scan, please? Just have a little poke around in there with my Morse scaler. I think that's it right up there. It's a little farther dorsal. Yeah, I can feel it. Pretty firmly in there. Just going to burr a little bit more dorsally. That's right, I got it. That is one big tooth. Can you guys see that? Use my electric cautery, please. I can see it. It's just a matter of whether I'm going to be able to get it out through this hole. Where is my Morse scaler? Thank you. So there it is right there.
How long would it be since you've used a dental scaler on a tooth, Charles?
A long time since I haven't touched a tooth since, for anything other than maxillectomy since my internship. Maybe finish that. Yui,
Yes.
take that. I'm going to try to expose the tooth a little bit more with.
Might try and slide it backwards and then forwards, huh?
Yep.
I'll go to the front of it.
There we go. Now, you, if you deliver this, you're going to be in big trouble. I want to do it. Damn it. There it goes. So that's the canine tooth out of the nasal cavity. And the crowd goes wild. Thank you,
Honestly,
man.
the comments section has never been so alive, Charles.
Has it? I'll go over and have a look. All right, so let's just pack this off with some gauze. Very exciting. Let's go back to the tooth. So there it is sitting right there. No wonder this dog was having nasal signs. All right, so we'll just tuck that in. And then we'll leave that for about 5 minutes. We can put in some adrenaline if you'd like. Yui?
I reckon we'll get control of it.
Okay. All right, I'll leave you to it. So just going to do a deep muscle. We won't do any closure over of the bone itself. We might get a little bit of subcu emphysema, but not a lot because it's so far rostral. And then we'll just do primary closure of the muscle and then of the intradermal layer.
Excellent.
All right, happy with that?
If I do use adrenaline, do you do 1 in 10 and use like a mil?
Yeah, I think that's fair. All right, so I'll come over and have a look at the comments. All right, so hi from Colombia, Riyadh, Mexico. And interesting surgery today. Dog presented with chronic nasal signs, so constantly sneezing. Kate from Gainesville, this dog has a retained canine tooth causing nasal signs for a couple of years. So question, hi doctor, this is off topic, but I'm studying for my NAVLE and came across a portosystemic shunt question and got the question correct because of you in your discussion of portal hypertension during surgery. Thank you. That's excellent. Great to hear. Gran Canaria, interesting case. The tooth got in there. It's just retained. So developmentally, instead of the tooth penetrating into the oral cavity, just again developmentally, I don't know if there was some trauma related to it, but it was retained in the maxilla. And so that's what it's doing there. Somebody's commenting that they do extractions every day with 1 to 2 patients at least. This is a Jack Russell Terrier. There's no dentigerous cyst on CT scan, it's just a retained tooth. So any risk of damaging the facial innervation? Not really. That far rostral, the only thing you'd be looking at would be branch of the trigeminal nerve, which is the infraorbital nerve. And if you damage that, you're not really going to see any clinical signs, maybe just some decreased sensation. And the approach is a dorsal lateral rhinotomy. Hi, California. No, we aren't going to do any bone graft. We're just going to close it primarily. So anyway, I'm just going to leave it at that. That's just a quick surgery. I hope to have another surgery to stream today. We'll see how we go. Thanks a lot for watching. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications. Question, would I have been able to get it out intraorally? No, we would not, because the palatine bone was complete. And we might have been able to get it through the nasal cavity, but given how much trouble we had loosening it even with that large rhinotomy, I think we would have really struggled. It is a permanent canine tooth. And it's gone now. So anyway, if you haven't already done so, please subscribe to our channel. Make sure you turn on the notifications so you'll get a ding on your phone the next time we live stream. Thanks again for watching, and we'll talk